Not a candidate? I bet you've heard that, or you know someone in your family who has been told that, specifically about LASIK. Well, all is not lost, not just yet, because we have with us today, one of the most world's famous eye surgeons, Dr. Gulani. He says that statement is misleading in most cases. So thank you so much, Dr. Gulani, for being here. We appreciate, I know you're a very busy individual, so we appreciate you stopping by. Because actually Nick was talking about it before with his wife, went to go get LASIK surgery. She was told that she wasn't a candidate, and then that was it. What does that mean, and is there really still hope to get corrective surgery for your vision through LASIK?
Yes, Casey. LASIK is only one among close to 40 different techniques and combinations that can be designed for each patient uniquely. Even combinations are required. Now, if your eye surgeon knows only LASIK or performs only one procedure, then guess what option you're going to get? Just that. So instead of being fit to a cookie cutter procedure, you must ask for a procedure that's designed to your individual situation. So the most common conditions that patients are told they're not a candidate for is because they have thin cornea, meaning not enough tissue to work the LASIK on. Well, you can do a non-cut technique where you do not use a blade, do not remove the flap, and do the laser by saving tissue. If people are very nearsighted and they cannot do LASIK, well, you put in a permanent contact lens inside the eye. If the patients have very high astigmatism, you can custom design laser vision techniques. So there are so many combinations, laser techniques, lens techniques, uniquely designed to that patient in a way that you tailored it to their best situation.
Yeah, I don't think people realize that, because when you think of getting LASIK surgery, you think of it as a one-stop shop. You're getting corrective surgery and that's it, but that's not the case. And that really goes to your philosophy as a doctor, and that is to tailor procedures and surgeries for each patient as an individual and not have it be a one-stop shop.
Think about it, Casey. If everybody had just one prescription, they could pick up glasses anywhere, right? So the concept is, and I talk about this when I'm joking with my fellows or students, I say, if all you know how to make is a burger and a hot dog, guess what you're going to offer? A burger or a hot dog. Yeah. But the patient should ask for the best recipe for their vision, and the doctors should know close to 40 different techniques or ingredients, if you may.
So if someone's watching right now and they were told that they were not a candidate, or something that they know or love was not a candidate, what are some of the most common reasons why you wouldn't be a candidate for LASIK?
So like I just said, first of all, they should have a thorough eye exam with their surgeon. Okay. Not just anybody, but have the surgeon see them in preoperative evaluation. Having ruled out any pathology or disease, the most important causes are thin cornea, when they're told you cannot do LASIK, well, but you can do other techniques. Very nearsighted patient, and you have other techniques like intracolumnar lenses like ICLs. The patients can have high astigmatism corrected. Patients can also have cataract in their early cataract age group, and you can go through that and use lenses nowadays for distance and near vision. And then you can even combine cataracts with LASIK surgery.
Yeah, which we talked about before, which is really kind of another thing that I hadn't heard about, that you can go in and get multiple procedures done and not have to worry about, or even some people don't even realize that you can do that. So those options are out there. What about reading glasses? You know, a lot of people, as they get above 40, and you see them when you go into the the drugstores, the CVS. If you go to your optometrist, is there something that you can do to get corrective surgery for those who need reading glasses?
Yes, you can. We are actually working on, in this book that we released our book chapters in, and we'll be talking about this at the national meeting in California next month, is there are blend laser techniques using the same LASIK laser. Then there are patients who may be wearing contact lenses for monovision, where you can replicate that with the laser. And then, of course, if they're in a cataract age group, we put in lenses in the eye that can help them see distance and near both.
Which is, I think, just simply amazing. And then what about, if you have somebody who has had LASIK surgery before, can they go back and get it again to do more correction, or once you have LASIK, that's it?
No, as long as you have enough tissue, there are many techniques to further correct previous LASIK or cataract surgeries, yes.
Okay, and then let's talk a little bit about your book, because you're getting ready to head out to California. You wrote a couple of chapters in this book specifically talking about new advancements in LASIK and also with cataract surgery. Where do you see this going? What do you hope to accomplish when you go out to California? I know have you been in Europe yet? I know you're getting ready to make another trip to go teach overseas as well. But where do you see kind of this going, and what have you mentioned in your book talking about advancements in this kind of technology?
Like we always talk about, Casey, that vision surgery to me is an art. How you design the surgery in the best interest of the patient. So you use all the technologies for cataract surgery, you use micron precision lasers with no-cut techniques for the modern LASIK surgeries, combinations, how you can address each patient with a unique, tailor-made plan and make them a candidate keeping safety in mind.
Yeah, so the moral of the story here is if you're wearing contact lenses, if you're wearing glasses, you're a candidate, pretty much. You know, not to rule anything out. You can come in and you can at least find out if you've been told you're not a candidate by somebody else, at least you can come in and see if there are other options.
Yes, after a thorough exam, making sure there's no disease, absolutely.
And real quick, what's the future do you see with this kind of technology?
I see the future as very bright in this because vision corrective surgery takes people to beyond 20/20 vision. That has to be our goal for the next 6 years, where we have to make sure every eye surgeon is aspiring for that goal in every patient. So vision beyond 20/20 is my dream.
Yeah, vision beyond 20/20, because everybody said 20/20 is perfect vision, but you can get better than that. You can get to
It's already there. It's already there. But
Yeah.
I want us to all be consistently aiming for that.
That's fantastic. All right. Well, thank you, Dr. Gulani. We appreciate your time and
Pleasure being here
perspective,
again.
as always, for being here.